Thanks, Lucy. Hi. Oh, thanks for being right in the middle so I can see you guys. That's awesome. And thanks to you guys online. I can't see you, but thanks for being here. And we'll have plenty of time for questions, is my plan as well. And even, yes, if you're online or in person, just feel free to raise your hand even during. So raise your online hand and we can take your questions and things like that during the talk or after. You know, we have a relatively small group and I really just want to personalize it to what you guys really could benefit from. So happy to just kind of go that direction. I do have some slides here to start with. And I didn't put in an introduction slide, but my name's Terry. I'm an occupational therapist and a certified driver rehabilitation specialist. So I have been working in this community in the field of driver rehabilitation since about 2011. And kind of through that time, my mom has been diagnosed with dementia. And so I'm in the caregiver role as well. Her driving privileges were taken away a couple of years ago, and it's different being the child and the caregiver as opposed to like having the professional hat on. So I really just want to like put that out there that I appreciate both sides of it, and that there's a lot of factors involved. So why driving? Like, why is this such a hard conversation? And it's because we care about driving. Like, driving means so much to us, and that's why it's hard to give up. Like, for most people, if you were to say, because of safety, I'm really just feeling like you shouldn't go to the grocery store anymore. I'm going to go to the grocery store. People would be like, okay. Like it's usually not like this big meaning. For some people, maybe. But driving has really been identified as one of the most important activities of daily living for older adults. And part of the reason is to get places. So the things listed here, participating in spiritual activities, exercise, visiting friends and family, and going out to eat have been identified as the top reasons why older adults drive. There's also this piece of it's not just about getting from one place to another, right? So we often come in and we're like, well, we can take you when we go out to eat. We can give you a ride. But there's also just this piece of people feeling like it's their independence. It's their sense of who they are. It's part of their identity. And I think especially for older generations, let's say, they grew up with like the car was the main social activity. Like as soon as you get your license, you get your car, you're cruising the strip. Like I have a colleague who's like, driving was our social media. He was like, that's how we connected with people. So there's such like a deep part about driving, whether or not this person actually needs to drive anymore, or he's even like driving very far. I think just acknowledging that it's a big part of who they are. And when someone stops driving, there can be negative health consequences. So a lot of times there's increased risk of depression, increased healthcare costs just between getting rides to healthcare appointments and decreased access to care. It's hard because that's not all because of driving, right? Like I think of like when someone's needing to stop driving, especially if it's often a dementia reason, like a cognitive impairment. But even if it's a physical impairment, it's not the driving that's the problem. It's the dementia that's the problem. But the driving is one of the most obvious kind of external symptoms. And then there's a lot of other things that go along with that decline. So I just want to mention some things about age and driving. To me, it's not really about age per se. Like, so when we are talking about someone's ability to drive, it's much more about like how they're functioning, kind of physically, visually, and cognitively, than about how old they are. But if we look at trends, these are all true. So the number of older adult drivers is growing rapidly for a variety of reasons, mostly because we're living longer, but we're also driving further. We don't live in these small, tight-knit communities, and we have further to go, and our families are further away. So they're also driving longer distances. The statistics show that older adult drivers are generally safe drivers with good driving behavior. So have not necessarily the ones out speeding, often not necessarily the ones driving impaired. However, when we look at the statistics for motor vehicle crashes, the rate is high, particularly starting at the age 70, the accident rate increases quite a bit. And when somebody who's 80 is involved in a crash, they are much more likely to be injured in that crash than the same crash for somebody who's 20 or 25. And so that has to do with just frailty of our bodies. That has to do with the fact that safety features aren't created for somebody in their 80s. They're really built around a 25-year-old male, like even like the placement of the seatbelt and all of these things. So there's a lot of factors that in that sense make driving more dangerous for all of us, or make crashes more dangerous for us as we get older. And then the risk of crashes increases largely because there's changes that happen as we age. And so we'll talk just a little bit about this. I do want to mention, like, this resource that I have, this Pomodoro, is through the American Geriatric Society. I have some great resources if you guys are interested. This in particular is the Clinician's Guide to Assessing Driving, and it's really geared toward physicians, but then also occupational therapists, social workers. But I have a couple of Hartford guys. Some of the information in this presentation is taken from these two guides. Oop, it's the same one. Look at that. No, they're not. They're not the same. Whew, upside down. These are freely available online, and I can get you guys kind of the links and resources for that. They used to send out the hard copy, and they no longer do that. We can just get it online, but they're fantastic resources too. So happy to share any of them. Okay, I'll send the link to Lucy. Perfect, thank you. So just in general, looking at driving on this range of activities that we do every day. So I'm an occupational therapist. Our role is to help people with their activities of daily living, getting back to them or finding the best way to do them. Driving, we think of in kind of its own category, but it's really just along this range of, like, can somebody get up and get dressed and brush their teeth, all the way to, do they manage their own medications? Are they paying their bills on time? Driving is kind of on that end of it, of these higher level activities of daily living. And a lot of times, if someone's having trouble with financial management, medication management, driving is something that should be looked at. Like, those kind of are in that same cognitive area. And this is more looking at, like, I mean, I think for family caregivers, but also like professionals in like an occupational therapy setting, when I talk to OT, saying, if you have concerns about that, then driving should also be something you're talking about. So let's just talk about those. I mentioned 3 categories: physical, visual, and cognitive. Let's just talk about physical for a second here. These are just things that tend to happen or change with aging. So sensation is a big one, and I feel like it's easy to overlook, but decreased sensation, especially in the feet, so could be called neuropathy a lot of times. It can happen because of diabetes. It can happen because of a back injury, back surgery. Sometimes it happens for who knows why. Idiopathic neuropathy, they call it, is just you're losing sensation and we don't know why that's happening. But it's really quite common. And sometimes that is one of those main things where somebody just can't quite feel if their foot's on the gas or the brake. And it's surprising to me, but then I talk to people who are like, some people are like, oh, I just look at the pedal. Or the people who are like, well, I couldn't really feel, so I started using my cane instead on the gas or the brake. So those are people that are aware of the problem. They're just not necessarily using the best problem solving, in my opinion. Pain. I mean, if someone is distracted by pain, it's going to take your attention away from all of your tasks. So driving is a huge one. Flexibility and coordination. So I feel like neck range of motion is one of those things that, like all of these things, if you don't use it, you'll lose it. And so as we're just, somebody maybe has another issue causing pain, and then they're not turning their head as much, and then they start not checking their blind spot when they're driving. Even that coordination between hands and feet. Reaction time is one we hear about, and that's real. I feel like that often, because it ties into the brain. So if someone's cognitive processing is changing, often their ability to react to things quickly in their environment is changing. So, and then a history of falls. I think I have a next slide here. Yes, on the link between falls and crashes. And so this is a study put out by the AAA Foundation, and they found that older drivers with a history of falling were 40% more likely to be involved in a crash than their peers. So it's a huge, huge percentage. It doesn't say why. Like there's some underlying beliefs of like, maybe your vision is a reason why you're falling, and maybe your vision is also impacting driving. Or some people with balance issues, it could stem from something else going on in the brain, or like dizziness or things like that. But I feel like this is one way to talk to folks who are having falls. Again, a trigger for like especially we're talking to professionals, if someone's having a lot of falls, let's also ask about driving.
I just feel like it's so related to this whole, like the flexibility, coordination, you know what I mean? Oftentimes as those go, that's when people start to fall, you know what I mean? And I never really like associate, although I don't know why, because my parents were prime examples of shouldn't be driving, but you know, the link between all of these other health concerns and executive functioning skills, people don't make that jump to, well, if they can't manage their meds, they shouldn't be driving. I mean, that's a big statement. You know what I mean? Like that's, so this is a very interesting conversation for me to start having. So I love it.
Well, thank you for jumping in with that. And I agree that especially the drivers that we work with, and I'll talk a little bit about kind of our evaluation and what we do, but they're like, well, it doesn't matter. My balance doesn't matter. I'm not standing up when I drive a car, right? Like one of the tests we do in the clinic is a rapid pace walk test. So just want to see you walk 10 feet, turn around and come back. There's a norm for that. Started out with people with Parkinson's, but we use it for a lot of other disorders. And people are like, why? Why is this? Like most of the things we do in the clinic, how is this related to driving? And we're happy to go through and talk about it with people because there actually are. The reason you are falling might also be the reason why driving is not safe, even if you're seated in a car when you're done. And maybe not. It's not a definite, but it's a factor. And then this is just kind of supporting that. This is a handout. This picture is for like CDL. So people who are professional drivers, bus drivers, people who drive for a living and have this specialty on their license. Like NHTSA has a whole thing about blood pressure, blood sugar, and cholesterol impacting driving. So even these like primary vital signs of our health are things to be aware of. So getting a physical every year, continuing with that Medicare wellness visit, paying attention, like diabetes, there's actually quite a few risk factors that can come with diabetes, like vision, like sensation, like sugar, high and low sugar episodes that affect cognition. That really can affect driving, but I think people don't link those in their brains very often.
My husband's a truck driver and I had no idea, but like when he gets his physical, I mean, they're actually looking at these things because his blood sugar was a little high this time and he panicked because, I mean, he would lose his job if his blood sugars are out of control. So again, I had no idea that the industry was regulated to that degree, but it makes me feel a little bit better about things.
It is a good thing, right?
But yeah, I mean, it's crazy, but yes, it's good guidelines for everybody.
Something kind of along those lines in terms of the commercial driving is where the research has been, is sleep apnea. So you guys familiar with that, or like people using a CPAP? And so one of our questions on our evaluation is, do you have a CPAP and do you wear it? Because kind of like hearing aids, lots of people have them, but don't wear them for a variety of reasons. But that was a big thing with over-the-road trucking, is like this drowsiness, daytime drowsiness is one of the biggest risk factors, regardless of cognitive function, for crashes. So with trucking especially, there's a lot, and that's why they have the rules about how many hours you can drive and all of these things. But sometimes someone just needs to wear their CPAP and then they won't have their daytime drowsiness and then they're a safer driver. So yeah, it's all related. We're all those humans. So we'll talk just a little bit here about vision. These are kind of the basic visual skills that we're looking at. So visual acuity is that clarity of vision. Contrast sensitivity is a little less familiar. That's not always tested in a typical eye doctor's appointment either. To me, that one's more important than visual acuity in terms of driving safety. So contrast sensitivity is our ability to see like a light colored item on a light background or a dark colored item on a dark background. So I think of somebody in a black sweatshirt at night is much harder for eyes that are 70 years old to see than eyes that are 20 years old to see, just because of how our brain and our, mostly because of the lens in our eye, and we need more light as we get older. So contrast, not just with driving, but there's a lot of research that that is a primary factor for functional disability in general. People have a harder time on stairs if their contrast sensitivity is poor. Find like where the curb is and the street can be trickier to see, going like from inside to outside. So there are a lot of like more subtle vision things that really are affecting a lot of us. And that kind of ties into depth perception too. So certainly depth perception is important when we're driving. And there's times where I'm in the car with somebody, I'm trying to decide like, is this just their driving habit? Like, are they just somebody who slams on the brake and stomps on the gas? Or do they just not realize that car's like we are coming up to that car so quickly, so they end up slamming on the brake. So that's where doing some things in the clinical evaluation help me differentiate those. And then visual fields is our field of vision. So it understandably is very important. The most often that can be impacted, like in terms of like someone's missing like half of their visual field, that's often from a stroke. But with dementia, it's more of a visual attention thing, and we can end up with more tunnel vision because of how our brain is processing information. So the vision, actually, there are a lot of ties, like people have less eye movements with as their dementia progresses too. So this can be a really important piece also. I do have just a couple specifics about vision here, and this is just different diagnoses, and maybe you're familiar with these. Glaucoma is the one where you go to the eye doctor and they squirt the air in your eye. So everybody's like, not that one. But that's looking at the pressure inside of your eye. And what that can cause, if you have an issue with that, is it reduces your peripheral fields. It's often subtle and people don't notice on their own. That's why a regular eye visit is important. Retinopathy, so another kind of note to diabetes, high blood sugar levels can cause damage to the back of your eye. And you can end up with kind of spots in your vision, and it can change from day to day, which can be kind of scary too. Cataracts, you're probably all familiar with. This one in this society is pretty well monitored and taken care of, but having cataracts that are not treated can affect your vision quite a bit. And then macular degeneration, you're probably familiar with that one too, but that one's more central vision and can really cause issues because you're not able to focus, like your focal vision is impacted. So when people look at something, whatever they're trying to look at may be kind of grayed out or blurred out. Cognitive. I have just a couple listed on here. Basically, there's a lot of ways in which our brain controls so many things. And if there's issues, then it's going to cause issues in a lot of different systems. Memory is one that sometimes people are like, well, it's not like I forget how to get to the store, even if I'm not remembering someone's name. And so that can be a tricky one to like discuss with somebody because oftentimes people don't recognize it so much. For caregivers, I'll also talk about how memory impacts. So sometimes what we see is they always take the dog to the dog park. And then they start being gone for longer and longer periods of time. And either they forgot they were going to the dog park and drove to the park 5 miles away, or they just started going and get distracted by something and then follow that. What the research shows is that this happens a lot more often than we talk about in our society, to where people are found in another state. You know, they went out to go to the grocery store. I mean, I had a patient referred because he was found by the police driving the wrong way on I-25 in Trinidad, and he was from the Springs. And so it really happens, I guess is my point here, that people, and I've even been in the car, like doing a driving evaluation with somebody, and we started from his home and he was going to drive me to where he plays golf. And we drove right by the golf course, and I was like, and we just keep driving. And he's just chatting, and he's driving safely. But I'm like, where are we headed? He's like, oh, I thought you wanted to go to the mountains. And we're like heading up Cheyenne Mountain and all that stuff. And so I'm like, I can see how this happened. Like, it just gave me a little glimpse into some people that are just in the car and they're not necessarily worried about it. There's actually been a lot of like education to law enforcement, because what happens in some of these cases is that person's pulled over by law enforcement, and law enforcement says, oh, she's really sweet, she reminds me of my grandmother, I'm not going to give her a ticket, I'm not going to report it, I'm just going to tell her house is the other way or something like that. And so the same person can get stopped several times. And so really educating like law enforcement that we all need to be helping, and by helping, we're reporting these types of incidents. So it's an interesting and tricky. On the cognitive side, attention, of course, and to me that even is just visual attention. Like if someone gets distracted by something in the car and they're not noticing something else happening on the road. Language we don't think of, but language is often tied to kind of our thinking skills. So that can be indicative of something. Processing speed is kind of like that reaction time I spoke about. How I see that in the car, or how I interpret that, is the person who's driving 10 miles under the speed limit pretty regularly. And they may, when I say, do you know what the speed limit is? Oh yeah, it's 45. And they may speed up when there's other cars around us, but when they're the only ones up, they're slowing right back down. And oftentimes I interpret that as like, that's just where their brain is comfortable. Like when they go faster, things are coming too quick and they don't feel comfortable or safe. So often that person will say to me, well, I just wanted to be cautious. And there's a point where cautious is not safe. Like there's an in-between part, but I'm kind of like, if you're more than 5 miles under the speed limit, that's something I want to try to figure out what's going on there. So, and then multitasking gets harder. I mean, for the general population, the largest reason for crashes, I guess, is distractions, as we are probably well aware of, like distracted driving. So for this population, it's even harder to have like a phone ringing in the car, but it doesn't have to be that. It could be a passenger that's talking to, it could be a news program that's upsetting. Like there's a lot of different ways that we multitask every time we get in the car. All right, so a couple things specific to driving and dementia, and these are evidence-based consensus statements. So they took a bunch of professionals and put them in a room and asked them to come up with some guidelines, basically. An individual with moderate to severe dementia should not drive. Those individuals with very mild or mild dementia may be appropriately referred for further testing, so coming to see somebody like me, when risk factors for unsafe driving are present. So basically, I would say somebody with a dementia diagnosis, people will call our office and say, my dad was diagnosed with dementia. Does he need to stop driving immediately? And honestly, I will say not necessarily. We see people who have a dementia diagnosis who are cleared to drive in some capacity sometimes. So I don't have a strict thing, especially diagnosis varies so much. I think we're coming a long way, but some physicians are reluctant to diagnose, and some people are very proactive and are diagnosed very early. So just the diagnosis doesn't tell me a lot about their level of functioning, basically. For an individual with neurodegenerative dementia, mobility counseling should start immediately, anticipating that driving cessation will likely occur in the future. And so to me, yes, but that's hard to do. But that's a reason also to come for a driving evaluation early, because we are going to start that conversation. Let's say somebody comes, they pass the evaluation, maybe with a restriction on there, we are still going to have that conversation of like, this is a when, not if kind of conversation. There will be a point when driving is no longer safe. How will you know? How will your family know? How will you agree to what they're telling you? You know, so just having those conversations of how will you get around when that becomes necessary. So if you have a loved one who is currently driving, what are some things you should be looking out for? So these are kind of some of the warning signs that you may hear about, or if you're a passenger in the car, you may get to see. Getting lost in a familiar area. Difficulty merging. So that is higher it's just a more difficult situation. That there's that depth perception, there's reaction time, there's a lot involved there. Difficulty making unprotected left-hand turns. So this would be a turn without like a left turn arrow. Again, there's that depth perception and reaction time. So a lot of times what happens, people lose that ability to tell how fast that car is coming toward me. So one of the most common crashes is someone's turning left and they get hit by the oncoming car because they thought they had enough space to make it. And then here's a driving 10 miles below the speed limit is also a warning sign to me. This is from one of these books, this little list here. It's a partial list, but just to give you an example, there's a lot of things that could be warning signs, right? Oftentimes we look at this and we're like, well, I've done that. Or like, yep, I've done that before too. And so it's not like that if you've ever moved into the wrong lane to make your turn, or all of a sudden you're in a right turn lane and you're trying to go straight, means you need to be evaluated. But there is this list in here really to help families. If you're able to be a passenger with the person you're concerned about, you can kind of use this as a checklist and be like, let's just see how things are going today. And then over time, if you're noticing patterns, then that might be a way to have that discussion, but also some information to share if you're having an evaluation. So this is from another Hartford resource, these discussions about driving. So this is the advice, their section on advice from experienced caregivers. And I agree with this. There's no easy answer. Sadly, I wish there was. And there's no right way. Like it really depends on your relationship with the driver, what their personality is. People respond to different things. Begin discussions and planning early and involve the person of concern. This is hard because most people want to avoid this conversation. It's not something we want to talk about early. So we can talk about it early enough that neither of us have dementia yet. That's ideal, right? Like to have this conversation of like, we're getting older, or you're getting older, or, I mean, we're all getting older. How are we going to make decisions about driving? Having this conversation just over time is a nice like beginning, just good starting point. Base decisions on driving behavior observed over a period of time. And of course, if someone comes to us, it's not a period of time. We're seeing them like for a one-time driving evaluation, but information from the family is super helpful, or from neighbors. Like if family isn't local, you kind of might get calls from somebody else telling you about this. I would say listen to those. If there's concerned people in their life, those are good to listen to. Get support when making and implementing decisions about driving. And so this is from At the Crossroads, which I will send you guys the link. I have this in here. This is relatively new and it's hard to read, and I'm not even going to go through all of it, but just want you to know this is what's currently on the Colorado DMV's website. Is they finally added something about driving retirement and some stages of having conversations, warning signs, and then retirement from driving. In the ideal world, yes. And I actually don't even have a copy with me, but I will make sure you guys have, because they're here in the building somewhere, I've been told. The Colorado's Guide for Aging Drivers and Their Families, which Lucy, we have here at PPACG. Okay. But part of the reason that guide was developed is because the DMV didn't have anything on their website about how do I do this? What do I do? Can I report somebody? What happens if I do? So we've spelled all that out and put that into the guide. So this is one resource, but the guide is a great resource if you have questions specifically about medical reporting and that kind of thing. Questions at this point? Anybody online? Okay. I'll keep going. So Fitness to Drive is the name of my company. We have offices. We have an office here in Colorado Springs. We have 2 in the Denver area and 1 in Fort Collins. So just if you guys have family members in other parts of the state. We are all occupational therapists, so experience with kind of medical conditions, but then have additional training in driver rehabilitation. So working with driving specifically. These next couple of slides are kind of what that looks like. So we would see somebody, generally someone's coming to us for the full evaluation. So that would be a 3-hour session. We can split that up into 2 parts though. But usually people just want to get it all done. It's kind of how it works. So we would see somebody in the first hour to hour and a half is in our clinic. So we're not even in the car to start with. We're looking through all those things I talked about. So we're looking at vision. We're looking at kind of that. We have a brake reaction time tester. We're looking at strength and range of motion. And then we are always looking at cognition. Honestly, we see people who are 25 and had a stroke, like doesn't matter the age, we are always looking at some piece of like brain function as well. But if someone's coming to us with a diagnosis of mild cognitive impairment, which is pretty common, or dementia, we have specific dementia assessments that we will do that give us a lot of information, kind of more detailed about maybe the possible subtype of dementia. So basically, we get an idea of the skills related to driving before we get in the car with anybody, which I think is important for us and important for them. And we do go out in our vehicle. We have a brake pedal on the passenger side, so kind of like a driver's side car. And so what that means is that that person has to drive our vehicle, which can be daunting. There are people who are like, oh, I'm not too sure about that. I only drive my vehicle, and I totally understand. Most of the time, when somebody comes, they meet us, they feel comfortable. We let them know we're just going to start in a parking lot. We're going to start in a neighborhood and let you get used to our car. It's probably not as different from your car as you think. I'm always a little concerned if someone can't find the gas pedal in my car. That's probably a sign, right? Like we need to have enough to be able to translate some of the information from our car to another car. But we do take our car, we're going to start in a pretty quiet environment and then progress. So we have a standard route, or sometimes we'll do an evaluation starting from someone's home, especially if they have dementia. That's our preference these days. And then have them navigate. So we may, before we leave the house, I want you to drive me to 3 places you go on a typical day. Can you tell me what those 3, like even that task is tricky of like, these are the 3 places and then remembering them as we go. But that gives us more of a realistic idea of kind of their driving environment and how they manage that. And then consultation. So then we come back, we leave some time. So we do recommend, strongly encourage that somebody drives the person doing the evaluation to the evaluation. There's a lot of people who want to drive themselves, but we really don't want that in case we're recommending they not drive at the end of it. So the good part of that is we have family present usually. So family's welcome to stay for the clinical portion. It's usually just the client and I that would go drive, but then we come back and talk about the results as a group. We will give you a written report. And these are kind of our recommendations, and we'll talk about all this at that consultation. Either you're doing great, fit to drive, keep it up. Unfit to drive, which does happen, not as often as people think, but it does happen, where the recommendation is it's time to stop driving. And we will have that conversation. And, there's time when family members, Dad, can you repeat back to me what Terri just said? Because it's hard and people don't want to hear it. And so families are amazing at kind of knowing what their family member will need. But then this last one, return to driving with restrictions, is fairly common for people with dementia, where the restrictions, and these are actually added to the person's driver's license. It could be something like driving within a 5-mile radius of home only. It could be night driving is very common. Interstate driving is very common. It could be a miles per hour. So driving only on roads 45 miles an hour or less. So those are, I like to say familiar locations only, but it's not super enforceable. So like the law enforcement side, they're like, well, I don't know if this is familiar or not versus what was the posted speed limit of this road. So we'll still give recommendations, but those are examples of things that can be added to the license. I didn't talk about it, but we do require a referral from the person's doctor for them to come see us. So we need a referral. best practice is to have a referral, partially so that we're getting like ideally some medical information ahead of time. Of course, if they have seizures, we want to know that ahead of time. Or like if the doctor has specific concerns, like in addition to dementia, maybe, but also for afterwards. So I, as the OT, don't report directly to the DMV. That would go through the doctor. So I'm putting my report together, sending it to the family, sending it to the doctor, and then kind of guiding the doctor and submitting that to the DMV. Have training or reeval as needed, and that really depends on what's going on. I will say we do not see somebody for training if they have a dementia diagnosis. Like, I feel pretty safe saying that across the board. You know, there's times where people will ask. So we're really looking at like, what's the prognosis? What's the ability for new learning? Most of the time when we're doing training, it's because somebody's learning to drive in a new way. So maybe they had an amputation and we're teaching them to drive with hand controls. We're definitely going to do training there. Maybe somebody had a stroke and their vision is different, but they cognitively are doing really well, and we'll do training there. If we're recommending they stop driving because of dementia, it's usually not a trainable task. The reevaluation piece, so let's say and this happens fairly often, is that we will see somebody and they're probably not driving at night anyway, not driving on the interstate anyway, but we will kind of put that on their license through their doctor that, you know, within these environments, they're still doing really well. We'll recommend you come back in a year for a reevaluation. And that's, you know, it depends. It can be more like 6 months to a year, depending on what the doctor's preference is. But if somebody has something that's progressive, we don't want to just say, yep, today you did fine, you're good to go. And so we do recommend at least a yearly reevaluation of drugs. That's a lot of things. Okay, that's my information, but I would love to see if you guys have comments or questions.